Dr. Gwenevere White is a board-certified pediatrician, originally from South Florida. Dr. White attended high school in Alabama and then attended Xavier University of Louisiana for her undergraduate studies. At Xavier, she graduated cum laude with a Bachelor's of Science in Chemistry and a Bachelor of Art in Political Science. After medical school, Dr. White completed her internship and residency at the University of Arkansas for Medical Science and at Arkansas Children's Hospital. During her final year, she was honored by her peers and named Resident of the Year and received recognition of excellence in community service and excellence in critical care. After residency, Dr. White moved to Bayfield, Arkansas, where she served the community as a general pediatrician. She returned to Little Rock in 2019 and joined the Department of Neonatology at the University of Arkansas for Medical Science, Arkansas Children's Hospital, as an assistant professor. Dr. White is married to Dr. Tremaine White, and they have 3 children. In addition to her healthcare duties, Dr. White and her husband are licensed insurance agents and own a farmers insurance agency. So I present to you Dr. Gwen White.
I appreciate the opportunity to share with you all today. Just a little update on COVID-19 and what is going on within our community. So our main objectives today are to discuss the history of COVID-19, to provide just a quick update on what's happening in the United States and here in the state of Arkansas, to provide an update on what's going on with COVID-19 in children, and then to provide some proven methods that we have to try to end this pandemic and dispel any myths about vaccinations. So just as a review, we all are familiar with what COVID-19 is. It's the disease that people get when they're infected with the SARS-CoV-2 coronavirus, which was first discovered back in 2019, and which we all know has just drastically changed our lives over the course of the last year and a half. It's spread from human to human contact and transmitted through respiratory droplets. So what that means is when you sneeze, when you cough, when you talk in close proximity, it can be inhaled. It can also, if a droplet touches a surface, so if you cough or sneeze and it lands on the computer or on the desk or somewhere, and I come behind you and I touch my mouth or my eyes or my nose, I can be infected with that virus. We still don't know exactly how much virus it takes for you to be in contact with for you to become infected, which is why it's important to protect yourself. The toughest part about this virus is that it can stay in your immune system in your body for 14 days without you showing any symptoms at all. Those folks are what we call asymptomatic carriers. And just to prove kind of how tough asymptomatic carriers are, I just had a situation just this past couple of weeks. I still go to Batesville sometimes and work up there. And we had a situation where there was a mother that was completely asymptomatic. She had her child. A couple of days later, after we've all kind of been around her, her child, she spikes a fever and she tests positive for COVID. We had more than 5 healthcare workers that were tested positive after that from interacting with this lady. She was an asymptomatic carrier, completely fine until she wasn't. So asymptomatic carriers are really are perpetuating this disease forward in a lot of ways. So from a racial standpoint, it's important to point out that Blacks and Hispanics are 2.5 times more likely to be hospitalized from COVID-19 and are twice as likely to die from COVID-19. When we look at vaccination rates, specifically with the Black population, about 10% of the COVID-19 vaccine recipients are now African Americans. This is a huge increase that has happened over the last couple of months. Initially, we were only at about 5%. So we're making some progress, but there's still a long ways to go from that standpoint. And so when we're looking at COVID-19 today, where we stand as a country is that we have 4.9 million cases and over 659,000 deaths. Here in our state of Arkansas, we've had over 472,000 cases. And our death rate here in Arkansas has reached over 7,200 now. When we look at the disease process that's going on now, unlike when it first started, 86% of our active cases are actually in people under the age of 44. What that means is that younger people are really the ones that are perpetuating this virus, especially now with the Delta variant that's going on. And with this Delta variant, we're seeing that people are becoming increasingly more sick, and they're requiring hospitalization at a faster rate than they were previously. What's really concerning to me as a healthcare professional is that our hospitals are starting to reach maximum capacity for beds and for healthcare workers. I always like to point out that having a bed is no good if you don't have a nurse and a physician and a patient care tech and all the people that we need to work with you. And so it's not just our bed numbers, but our healthcare workers. Our healthcare workers are becoming ill and sadly enough are becoming burned out. We have workers now that have been on the job for years upon years and have just literally in the middle of shifts quit and just said, I cannot handle this. The amount of death that they're seeing on a daily basis in conjunction with them becoming ill on their themselves, really for a disease that at this point we can really prevent, it's just becoming overwhelming. And so the way it's looking is just very disheartening from a healthcare standpoint today. As a pediatrician, I pay very close attention to what's happening with COVID-19 in kids. And right now, the Delta variant is seriously affecting kids in a way that we have not seen with other variants. Currently, we have more than 6,200 active pediatric cases, and these are kids under the age of 18. We've had nearly 800 children that have been hospitalized due to COVID-19 here in the state of Arkansas. And sadly, we've had 3 pediatric deaths here in our state. We have kids right now that are in the intensive care unit due to COVID. And so this is something that is not just affecting adults, but it's affecting our children as well. So how do we end this pandemic? That's the big question before us. The first thing is that we can wear masks. I know that I don't know how it has become a political thing, but it's not a political thing. It's a scientific thing. Wearing a mask is simple. And I wear a mask to protect you, just like you wear a mask to protect me. What people don't realize is that when you wear a mask, if you are COVID positive and you're wearing a mask, or if you're COVID positive and you're not wearing a mask, we need to try to continue to socially distance. Now, this is kind of the toughest part of this, but if you are outside of your normal bubble, your normal circle, and you're indoors, you need to be wearing a mask. If you can be outdoors, that's perfectly fine, but keeping that safe distance is critical. If you're going to be inside with someone for longer than 30 minutes, keeping an adequate space is critical. So wearing a mask and social distancing is still very important. And then you can get vaccinated. So this is my actual vaccine card. As you can see, I was one of the first people to get vaccinated when it became public. I got vaccinated back in December of 2020, and I got my second dose back in January. I'm getting my third dose at the end of this month. So I'm a huge advocate of vaccines, and it is safe. We know that it is safe for pretty much all people. It's safe in pregnancy and it's safe in breastfeeding moms. And so I'm a strong advocate of getting vaccinated. So with that being said, I want to talk a little bit about vaccines, just to kind of make sure everyone is familiar with what we're talking about when we talk about vaccines. So just a few little definitions for you. An antigen is a virus or bacteria that invades your body that will make you sick. Okay, so when we talk about COVID-19, we're talking about an antigen. What happens, what an antibody is that when an antigen comes into your system, it causes your immune system to create an antibody. The antibody is what fights the bad guys, okay? It's what fights all those antigens that aren't supposed to be in your body. After antibodies are created in your immune system remembers how to fight off any type of bad thing. And so what we do with vaccines is that we use either dead antigens or weakened antigens to cause your body to produce antibodies so that if you're faced with it again, your body already knows how to fight it off until you do not become infected. I know that you've probably heard the phrase herd immunity, and herd immunity occurs when enough people are vaccinated so that the disease is not spread to unprotected or unvaccinated populations. So when we look at the COVID-19 vaccines, there are 2 major types that we have. We have the mRNA vaccines, which are your Moderna and your Pfizer. And then we have the adenovirus type vaccines, which are your Johnson & Johnson and AstraZeneca. Those are over in Europe, or the AstraZeneca is over in Europe. The adenovirus vaccine is a type that is kind of the more traditional type of vaccine. So when we look at the kids that get vaccinated and that type of thing, the adenovirus is that type of vaccine. The mRNA vaccine is a newer type of technology. And one of the big concerns that I've heard many people say is that it came across too quickly. This is a new type of thing and it needs to be studied more. So what I like to explain to people is that the mRNA idea behind it first started being studied back in the mid 1990s, and the actual vaccine technology that we're using with these vaccines actually began back in 2011. And so this is not a brand new thing. This is something that has been studied for years upon years. The only new part is figuring out exactly which spike protein we would use for the coronavirus antigen. And so these vaccines are super cool from a scientific standpoint because it allows you the opportunity to basically use a little bit of mRNA that gets injected into your system with that codes for this spike protein. And when it gets into your system, it causes your antibodies to form, but then the mRNA disappears. So this vaccine literally leaves your system within a matter of minutes to hours. It's just a really neat technology, and it's safer than pretty much any other vaccine that we have because it leaves your body so quickly. Up here to the right, I have Dr. Kazmikia Corbett. She is one of the primary investigators that helped to create the mRNA vaccine for the Moderna company. So the emergency use authorization was granted back in December of 2020, as we all know, for Pfizer and Moderna. I'd like to point out that just because the emergency use authorization was given does not mean that it was not well studied. At the time of the authorization, each of the vaccines, the Pfizer, Moderna, and Johnson & Johnson had over 40,000 people that had been tested with their vaccine and had shown that they are extremely effective. And so that is why they were given the green light to move forward. Full approval for the Pfizer age 16 plus was granted back August 23rd. And the Moderna vaccine is not far behind that. Emergency authorization for kids under 12 is supposed to be happening coming in October for Pfizer and towards the end of October into November for Moderna. So we will be able to vaccinate our younger kids as well. And I like to point out that more than 1 billion doses of vaccines have been administered worldwide. It is the most well-known vaccine that we have right now, and we know that it is safe. I'm sure that everyone's heard about the booster shots that are on the horizon as well. Starting with Pfizer, the approval should be done by the end of this month. With Moderna, it'll probably be the beginning of next month, where we can start getting booster vaccines if you are at least 8 months from your last last vaccine. So as I mentioned before, at the end of this month, I will be getting a booster vaccine because again, it is safe and it is the way I can protect the people that I love. So a few stats just about Arkansas specifically. About 54% of Arkansans that can be vaccinated have had at least one dose, and about 43% are fully vaccinated. Comparing that to our nationally, about 75% of adults have received their first vaccine. So here in Arkansas, we have a long way to go from a vaccination standpoint. And vaccines are important because when you look at the statistics, more than 98% of the deaths and hospitalizations that occur with COVID are occurring in unvaccinated individuals. So we know that vaccines are protective. We know that they work. So you get vaccinated. So then what? It's important to know that vaccines are not 100% effective, and you can still contract COVID-19 if you are vaccinated. However, you are much less likely to have severe disease and to have death if you have received a vaccine. With some variants, you are less infective, which means that you're less likely to spread COVID. We found with the Delta variant that that's not necessarily the case, but with some of these other variants that are around, you are less infective when you've been vaccinated. Because we have not reached herd immunity, we must still continue to practice social distancing and wearing masks. I know that that's not a popular thing, but again, it's something that we have to do to try to get this under control. Because once this is under control, we can all move forward together. And so it is safe to be around people. I recommend getting a bubble. And so it is safe to be around people that are fully vaccinated and not wear your mask as long as you know that they're within your bubble. But it's not safe within large crowds because there are still lots of variants that are out there. And those variants can cause you to become infected. And it is, of course, safe to go places while wearing masks. You know, I'm not a big advocate of just isolating completely. Everyone has to go to Walmart. Everybody has to, you know, do things with the people that they love. And so if you're going places, just wear a mask while you do that. And so I just want to end and open up for questions, but I want to end with this slide. When I think about why I got vaccinated, this slide pretty much summarizes it. The picture on the left are my babies. They're all under the age of 4, and so they are not eligible for vaccine right now. So I got vaccinated to protect them because there are kids that are in the hospital that I take care of on a daily basis that have COVID. And so I want to protect these children. The lady that's with them is my grandmother, their great grandmother, who will be 85 years young coming up in about a week or so. She is probably healthier than me and probably half of us on this call right now. And she's also fully vaccinated, but because of her age, she is at increased risk for severe severe disease if she were to contract COVID. And so I got vaccinated to make sure that she is also protected. The picture on the right is a picture of my family doing what I love to do, which is traveling. My parents and my mother-in-law, my husband, my oldest son, we went to Hawaii right before COVID hit. And one thing about me is that I love to travel. I love to eat good food, and I love to spend time with the people that I love. And so for me, getting vaccinated is all about getting back to what I love to do. I need to go be on some island in the very near future where I can just relax and enjoy myself. And I will feel much safer doing that if we can have this pandemic under control. And then this middle icon is kind of a summation of what I feel like my calling in life is, and that's helping people. And so whether it's serving people through my church, serving my family as a mother, as a wife, as a sister, as a daughter, whether it's serving the people, my patients in the hospital, or whether it's serving people through our insurance agency, making sure that we get people set up and protected with their home and auto and their businesses, or setting up for generational wealth through our life insurance programs. Whatever it is, I feel like it's my job, my responsibility to help people and to serve people. And I can't imagine a better way to serve my community and help my community than to help protect myself and help protect them with my vaccination. So with that, I will open up for questions.
Dr. White, this is Esther Dixon, First Vice President. I thank you first and foremost for being with us today to present, and I've learned so much from your presentation, and it was a lot of vital information. I wanted to ask you about the card that we receive once we're vaccinated. If for some reason that card is misplaced or lost, is there a way or process that you could go through to get a new card or replacement card?
Absolutely. So all vaccines are actually input into the Arkansas State vaccine database. And so if you contact the Department of Public Health, they can actually get you a vaccine record that shows your proof of vaccination. I
was going to ask a question concerning the booster shot, but you had answered that concerning whether they were going to be specialized for the different specific vaccines that they had. And you did say that the first one to roll out would be the Pfizer?
Mm-hmm. Yes, ma'am. Yes, Pfizer will be rolling out probably by the end of this month, and Moderna is about a couple of weeks behind Pfizer with their data. So they should be coming out in October as long as everything is cleared.
Okay, great. Thank you so much.
Yes, ma'am.
My question is, if you have COVID-19 or whatever, the virus, and you have it, and then you get well. I mean, in other words, you don't have to go in the hospital. You're able to fight it off at home. How long do you have to wait, or should you wait before you get your next shot, or before you get the vaccine, if you hadn't had the vaccine?
That's a very good question. So if you receive monoclonal antibodies, which is a treatment that we use, they recommend waiting 90 days. If you did not receive any monoclonal antibodies, you can get the vaccine within 30 days.
Within 30 days?
Yes, ma'am.
Okay. All right. And that was a question I was curious about. But thank you for your help. You did I love you. You did a very good presentation.
Oh, thank you very much.
Can you revisit once again what the minimum age of the vaccine is?
Absolutely. So right now we have emergency authorization for people that are 12 and older, starting hopefully by the end of September, the beginning of October. Pfizer has applied for 12 and under. I do not know if they're going to be cleared for just the 5 to 11-year-old group or maybe even a little bit younger. There's actually been testing that's been going down as low as 6 months of age. But hopefully for sure by the time October hits, we should have some use for kids under the age of 12 as well.
I was curious with the Delta variant, it seemed like it had a greater impact on children than the, I guess, first run of the virus or first couple of runs. Do we think that that is due to the fact that kids were not in school when the virus was originally hitting, or is it something different with this variant?
So I think that it's honestly a combination of both. So the Delta variant itself is more infectious. The way the virus has mutated has caused it to be able to spread more easily. In conjunction, we had a lot of safety measures in place, like the mask mandates and all of those things, prior to the Delta variant hitting. Once the Delta variant hit, that was kind of this past March between March and May is when the Delta variant arrived in Arkansas. And by June, it was pretty much the predominant variant that we were seeing. That was right around the time that we stopped mask mandates and that everyone just decided to live their best lives. And so I think it's a combination of it is definitely more effective, but at the same time, we also kind of let down our guard and stop masking. So.
Gotcha. Thank you. And then I had one other, and this just happened this past Friday. I was talking to a friend who's a little skeptical about the vaccine.
Mm-hmm.
And one of the reasons she is skeptical is because she says that the vaccine is not really a vaccine. And so as a physician, how would you address that statement?
So by definition, a vaccine is where you take an antigen and introduce it to the body in order to create an antibody response. And that's exactly what this does. You take the antigen, which is the spike protein, and you introduce it to the body, and it allows your body to produce an antibody response. So scientifically, by definition, it meets the criteria.
Got it. Thank you.
I do have a question.
Go ahead.
My
Ms. Nichols.
question is, you said it's safe for pregnant women to take the vaccine, and has it been found at all that once the babies are delivered, do they have any of the antibodies?
That's a very good question. It is completely safe for pregnant women. In fact, I have seen the number of situations where I've seen where actually babies are having to be born premature and taken away from parents because of the lack of the vaccine has been just extremely saddening. We're seeing it every day now, unfortunately. But yes, babies can get some of the antibodies. So the vaccine itself does not pass to the babies, but the antibodies can be found in babies' bloodstreams. Additionally, similarly with breast milk, mothers that are breastfeeding mothers are able to pass the antibodies through the breast milk to the babies. And so it's a wonderful way. I'm a breastfeeding mom, and so it's a wonderful way to help protect our children.
Awesome. Okay, I had the last question is, as far as quarantining, if you suspect or you've been around someone that is tested positive, is it still 14 days or has that changed?
So the CDC has given, the CDC says that 14 days is still the ideal situation. They have allowed some laxity in the definition and said that 7 to 10 days, maybe if you're asymptomatic and you're wearing a mask and doing these things. But if you read all of it, it says 14 days is the ideal amount of time.
Okay, thank you so much.